Can you walk us through what a typical consultation with a male patient would be?
Sure. So usually, like how I begin, we always, make sure we check ID just so we have the right patient. But then I want to get a little more of a history of what more symptoms are they having. A lot of times in the intake, it will just be like a one-liner, like I have fatigue. So I want to go a little deeper. Like, what do you mean by the fatigue? How is your sleep? What's your stamina? Are you getting to the gym? Are you just not able to? I think I've said this before, and I say it to a lot of patients. I always ask them about their mojo. Like, how are they feeling? Like, do you want to sit on the couch, or do you want to go out with your friends? Or do you want to have that relationship with your partner, or you're like, I'd rather just go to bed? So I want to know those things. I want to know about medications. I want to know about supplements, family history. And then I also think it's really important to know if a patient has seen like a primary care doctor within the year, like having other blood work. For me, when I look at the blood work, it tells me a lot, but then I'm curious about other things like vitamin D levels or thyroid. So that's kind of how I start, like the history. And then I usually flip my screen around for my patients so they can see the blood work that I'm seeing, and I go through it. I give them a little, medical degree background, and I explain what each lab means and what they mean for them and how it's affecting their body. And it gives them an opportunity to ask questions or to be like, oh, there's just not one number we're looking at. There's more to it, to the hormonal symphony. And then we talk about options. How can we, if someone's truly deficient, like medically, what should we do? If someone needs optimization, what should we do? And, the pros and cons and risk factors, and then understanding the importance of having your hormone balanced appropriately, or I like to say optimize. And I like to go through that with all my patients. Sure. And then at the end, as a team, we come up with a plan.